Right, cardio test number 4, which is blood pressure. So blood pressure test measures the force of the blood against the walls of the arteries during the two phases of the heart cycle, which is systolic, when the heart contracts, and diastolic, which is when it relaxes. It's a very important measure of cardiovascular health and is often known as a silent killer. And this test can really helpfully identify hypertension in your clients or hypotension. So this can show early signs of heart disease, stroke risk, or kidney issues, and is a really good screen for people to do. So it should be part of any new fitness assessment for clients, especially over 40, or with risk factors such as a sedentary lifestyle, overweight, family history of heart disease, or smoking. If a client has a known history of hypertension or heart disease, blood pressure should be checked anyway on a regular basis to make sure it's being managed. And it can be useful before doing intense training sessions to see how the intense training program over a period of time basically helps improve a client's blood pressure. Because some people respond better to, and this is very inter-individual and something that I haven't got data to document, but like in terms of research, but I've seen in practice. Some people do really well with dropping the blood pressure with high intensity interval training. Some people do really well when they're just dropping weight in general. Some people do it with long, slow distance. So each person responds to something different. Now, pre-test preparation, they relax 5 minutes, feet flat on the floor, back supported, no caffeine, smoking, or exercise for at least 30 minutes before the test. They should feel nice and calm and relaxed. And then from here, we start the test with the client in the chair, arm supported at heart level, left arm. And what you want to do is place the cuff on the arm and use even a sphygmomanometer or a electronic automatic blood pressure monitor, which I recommend them. They're much easier to use to test the client and see how they go. Now, you can take 2 or more measurements, waiting 1 to 2 minutes between readings to see if there is a big difference, and you can use that to take the average. So record the result as systolic, diastolic, e.g. 120 over 80, with systolic being higher and diastolic being lower. I recommend most coaches get, if they're in person, one of these monitors. They're really easy to use. They give really quick results, and they actually record the result as well. Now, with scoring, systolic is less than 120, diastolic less than 80, ideal range for most people. Pre-hypertension is 120 to 129, and diastolic less than 80. It's kind of like the client, is at an increased risk for being hypertensive, but not there yet. Hypertension stage 1 is 130 to 139, and blood pressure, diastolic over 80 up to 89. Hypertension stage 2 is 140 over 90 or higher, and hypertensive crisis is 180 over 120, and they need immediate care because there is something bad that is going to happen to that person. So it's a really important screening test to do. So ideal, 120 over 80. There's lots of ways to do it. Everything we talk about in this course helps you do that. And it should be measured regularly to track trends over time. For older clients, you'd be looking at every 3 months. If a client is an enhanced athlete, so they're using performance-enhancing drugs, they want to check it weekly because they're putting their body under far more stress. So common faults are an improper cuff size, either too small or too large. So the cuff needs to be appropriate. It's generally not too large for arms if people think it's due to hypertrophy. It's generally due to people who carry a lot of weight. So your arms are probably not going to be too big for it if you're worried about it from a hypertrophy perspective. Movement or talking can certainly change it and elevate pressure, and faulty equipment can be at fault too. So if you see like 3 measurements that are all over the place, it's highly likely that it is faulty equipment rather than actual user error at that point. So normal readings suggest the client has a good cardiovascular system. Keep doing what they're doing. Elevated blood pressure means they need to start changing their lifestyle and doing their exercise. If they've got hypertension, they should probably consult with a healthcare provider for appropriate strategies. And if they're in a hypertensive crisis, immediately refer out to a healthcare provider or a doctor or emergency to get them checked out to make sure that everything is okay. Now, related testing are going to be heart rate test and stress test. People doing the stress test in hospital if they need that to get help. And you don't do this test when someone's got acute illness or fever or post-exercise because blood pressure will be elevated in both those scenarios.